All right. Hello everyone. My name is Adam Gentis, and today I will be talking about a serious health issue stemming from both the United States and Canada, and I will be addressing the challenge and what we can learn from both. So why suicide? Well, suicide remains as one of the leading causes of death in both countries, cutting across age, race, and gender. It's just not a medical issue, but it's also a social, economical, and cultural issue. So how's it being monitored in both the US and Canada? Well, it's being tracked through national health agencies. The US uses the CDC and National Vital Statistics System, while the Canada relies more on Statistics Canada and provincial health reports. So there's been some fluctuating trends stemming over the years, as you could see up here. From about 1999 to 2018, the US saw suicide rates increase by 30%. In contrast, Canada's rates have been more stable, though there are troubling increases in both youth and indigenous communities. The COVID-19 pandemic had a big impact as well, as both nations saw spikes. Um, Isolations, job loss, and uncertainties made things a lot worse. And the mental health toll was and still is profound. Um, a major step forward for both countries, I believe, is the 988 Suicide and Crisis Lifeline. It is a free 24/7 support system available nationwide, helping people in moments of intense despair and need. Um, so then you look at the differences in data collection, and here's a big difference. Canada's health system is decentralized, which means province collects its own data. Each province collects its own data, leading to some inconsistencies compared to the US's more unified federal reporting. Um, Policy approaches in the US, suicide prevention is managed federally but implemented by states. Canada's provinces also take the lead, but within a universal healthcare framework, making care more accessible. Healthcare systems. Canada's universal healthcare means more people can get health. The US system is great if you have insurance. Otherwise, it could be very expensive and hard to navigate. Um, the gaps in between access. While Canada struggles with wait times, the US battles affordability and fragmentation. Both need more investment in accessible, equitable mental health care. The cultural views on mental health, stigma is slowly decreasing in the West, with therapy becoming more normalized. But in many global cultures, suicide remains taboo, tied to shame or spiritual weakness. Socioeconomic factors, poverty is a major driver, lack of education, job insecurity, food and housing instability. They all add to this chronic stress and despair, especially in lower income populations. Suicide across class lines, even wealthy individuals aren't immune to it. High pressure environments, like elite schools or corporate settings, can lead to stress, isolation, and even more despair. Government investment, Canada funds mental health care through its public system, while the US access often depends on what kind of insurance you have or if you have any at all. The national coordination, so Canada's federal government offers guidance and funding, um, but the provinces drive the programs. In the US, there's more of a wide variety from state to state in what is offered and how it is funded. In terms of partnerships, both countries work with schools, hospitals, and community groups to spread awareness and offer support, but coordination is often stronger in Canada as it's more centralized system. Then we look into India. Let's shift to a more developing country. India spends about 2.1% of its GDP on healthcare. Public mental health services are limited and out-of-pocket costs are very costly. Suicide data in India. So despite limited infrastructure, India tracks suicide rates through the government agencies. In 2022, the rate was about 12.4 per 100,000, which is close to Canada and slightly below the United States. So what's working and what's not? What we can say is Canada's system offers a broader access but needs more providers. The US has innovative tools but struggles with its inequality. Both need to reduce stigma and boost support. And finally, the final thoughts is that suicide is a preventable tragedy. We need coordinated access and action, affordable access, and cultural change in both the US and Canada and globally, as life depends on it. So.